Hi, and welcome back to Focal Point AFR Talk. Brian Fisher is my name. Great to have you in the conversation. I want to talk a little bit about healthcare just for a second. Let's grab, if we can, Rob, grab the Tom Price clip number 8. If we can. We played one soundbite from Tom Price yesterday. He's a doctor. He's in the Congress. He supports the effort that we are promoting here at American Family Association, the Tom Graves bill. It's a continuing resolution that funds all of government, even the parts we don't like. It funds the entire government except for Obamacare. And it says not a penny, not one penny for the implementation of Obamacare. That stops dead in its tracks, and you can do that through a continuing resolution. Now, you're going to hear representatives say you can't do that. That's contrary to the House rules. That is baloney. The House does this all the time. They use funding appropriations bills to make statements on policy. Back in 1982, for example, when Ronald Reagan wanted to help the Contras, the Congress was in the hands of the Democrats. They passed an appropriations bill that prohibited the administration from using any federal funds to get resources to the Contras. That was a funding bill, and they used it to establish policy. You can't spend any money on the Contras. Well, House today doing the same thing. You can't spend any money on Obamacare. Absolutely, perfectly constitutional, perfectly legal. They're playing by the rules. And again, you think about the Hyde Amendment. Hyde Amendment is an amendment to appropriations for Medicaid. Now, Medicaid is one of those programs they say are mandatory programs. And they say you can't make changes in mandatory programs. Well, they're doing it every year with the Hyde Amendment. It's been in effect every year since 1976. Medicaid is a mandatory program, and year after year after year, the Congress says this is a mandatory program, but you cannot spend any federal money on abortions through Medicaid. Cannot be done. We're not going to pay for abortions through Medicaid. That is a mandatory program, and it's being changed, altered, affected by an appropriations bill. It can be done. Do not let the Republicans lie to you. Remember yesterday we had David Brooks saying, hey, we got this rise of Ted Cruzism, and it's a bad deal because he is fighting, he's campaigning, legislating against his own party, to which you and I say it's about time. We understand, you and I understand, that our problem is not the Democrats. They are predictable. They're going to do the same thing every time. They don't even pretend to stand for principles like marriage or the sanctity of life. They don't even make a show of standing for those principles. It's the Republicans that have a platform to which they pay lip service. Say, yeah, we believe in marriage. Yeah, we believe homosexuality is a bad idea. We believe in sanctity of life. We believe in limited government. We believe in a balanced budget. And then they do nothing. They do nothing to implement those policies, to actually run or govern by that platform. Instead, they jump ship and they join, they join the Buccaneers. They go to the other pirate ship, and they hang out with the guys on the other team. So we know that it's the Republicans that are the problem, and we need guys like Ted Cruz, Tom Graves, Tom Price that are willing to stand up and fight the John Boehners and the Mitch McConnells to defund Obamacare. It can be done. Now here's Tom Price. He was on a Sunday morning talk show, CNN, I believe, and he's talking about what needs to happen with this Obamacare, why defunding Obamacare is the thing to do.
It needs to be changed, it needs to be fixed, and it needs to be fixed now, brothers and sisters.
That's a union leader.
Winners and losers in this, and that's why they have chosen to delay or waive fully a third of this piece of legislation. We believe, however, that it needs to be waived and delayed for the entire American people, for the entire country. That's the only fair thing to do. Now, what the unions have done, what the FFL-CIO has done, and what the Teamsters have done is finally read the bill and recognize what's in it. And they know that what the president said, that is, if you like what you have, you can keep it, simply is not true. And they believe they've been lied to, and they believe that we need to step back and say, let's just stop the madness, let's delay this for a year, and see if we can't get it right. Move in the direction of patient-centered health care, where patients and families and doctors are making medical decisions, not Washington, D.C. That's what we need to be doing.
So that's Tom Price making the case for defunding Obamacare. So, in fact, the CBO has got an entire category. It's called chimps. spelled just like it sounds, like the little animals, the furry animals that play around in the zoo. It's called chimps. That's short for changes in mandatory programs. That's what a chimp is. It is a change in a mandatory program. CHIMP, change in mandatory programs. They've got an entire category for this at the CBO because it is something that can be done. You can make changes in mandatory programs through appropriations bills. Even Paul Ryan is out there saying, no, you can't do that. This is an entitlement. This is a mandatory program. Ladies and gentlemen, entitlements can be changed anytime Congress decides to do it. They can change the funding mechanism for Medicare. They've done it every year. They postpone that doc fix every single solitary year. They've changed the disbursement formula for Social Security repeatedly over the course of time because we were flush with cash, all these young people working hard, few retirees, now the shoe's on the other foot. But none of those programs are etched in granite. They can be changed by the will of Congress. So don't let Republicans in Congress lie to you about this. These programs can be changed, and be changed. They need to be changed. You know, I went over this story yesterday. Betsy McCoy, New York Post, saying, look, President Obama is going to order your doctor to ask patients very intrusive questions about their sex lives. This information is going to be entered in an electronic record. It's going to be available to anybody who has access to those electronic records. We already know that the security mechanisms here are very weak, very poor, no guarantee that anybody's confidential information is going to be private. And if they don't supply this information, if they don't ask the questions, don't put this confidential information about private sexual behavior on their the information, the electronic health records, they're going to get penalized. They will face penalties from Medicare and Medicaid. So the federal government is basically using extortion to get them to ask very intrusive, entirely inappropriate questions about their patients' sexual lives. Now, President Obama will play the soundbite here in a minute. President Obama say, hey, there's no evidence that Obamacare has affected the economy whatsoever. No evidence whatsoever. I'm looking at a story right here. Human Events, 41% of small businesses have frozen hiring because of Obamacare. 41%. So President Obama's out there saying, hey, there's no evidence that this has impacted the economy. Here it is. 41% of small businesses have stopped hiring because of Obamacare. 38% say they pulled back on expansion plans, and 19% say they've actually fired people because of Obamacare. They've reduced the number of employees because of Obamacare. 41% say they've frozen hiring. They're not hiring anybody else. And on a separate issue, 38% say they have canceled expansion plans. So there it is. And this is from CNBC. And CNBC says, look, we were startled because we know that employers were concerned about the Affordable Care Act and the effects it would have on their businesses, but we didn't realize the extent to which they were concerned or that businesses were being proactive to make sure the effects of Obamacare were minimized. If the small businesses' fears are reasonable, and they certainly are, then it could mean that the small business sector grows slower than what economic conditions otherwise would indicate, and small businesses have been a growth engine in the economy. In fact, 70% of all the jobs in our economy are jobs in small business. They are the engine that drives our economy. Well, let's grab a couple of phone calls. Let's go to Dwayne, Jackson, Tennessee. Dwayne, welcome to Focal Point with Brian Fisher. What's on your mind?
Hi, Mr. Fisher. Thanks for having my call.
Yes, sir.
Just wanted to share some information with you. There's been a call on your program the last 3 days or weeks even that, asking people to call their congressmen and stuff and find out where they stand on signing on as sponsorships to these agendas to defund Obamacare. And what I found out, at least wise in the state of Tennessee, and we have 11 congressmen and congresswomen, 9 of which are representatives, 2 senators, and 1 senator I found was on board with it. 1 was not. I called his office, and before I even go there, the other representatives, I think there were 2, 1 Democrat, 1 Republican, that were not on board with anything yet. But primarily everyone is. The senator's office told me that he didn't feel like he wanted to support anything like that because of the fact that I think the term they used was diversive laws that are attached to Obamacare, but outside of that realm that will be funded anyway. And an insignificant amount will actually be going to about money to fund that.
And see, that's where he's just wrong. He is just absolutely flat wrong about that. No money can be spent. And this is what is kind of aggravating to sit where we're sitting, Dwayne, because we know better. We know, I'm not saying that they're lying to you, but they're just wrong. Because we know, according to the Constitution, that no money can be spent by the federal government unless Congress appropriates it. There's nothing that's on autopilot there. Anything can be changed anytime. One Congress cannot limit the actions of a future Congress. That's why you can have no Obamacare in 2008, and you can have Obamacare in 2009. No Congress. That's why you can change the budget every year. That's why you can drop programs and start new ones, because no Congress can be limited by the actions of a previous Congress. So that's why you can have don't ask, don't tell for 18 years, and then they can get rid of it. They can put it back if they want. I mean, no Congress can be restrained by a prior Congress. So when they say that, I mean, Dwayne, that's just simply not true. I mean, they're not even understanding the Constitution. I mean, the Constitution is very clear that you can't spend a dime on anything, on any program, mandatory or not. You can't spend a dime on that unless Congress appropriates it. So if Congress doesn't appropriate the money, and anybody in the House of Representatives ought to know that. Today's Constitution Day, by the way, 1787, on this date, the Constitution was enacted. They ought to know. I mean, they ought to know the Constitution. If it's not appropriated by Congress, nobody can spend it, whether it's on Obamacare or whether it's expanding fish hatcheries. If Congress doesn't appropriate it, they can't spend it. Obamacare can, in fact, be defunded. Do not let your Republican congressman tell you any different. All right, Dwayne, listen, I appreciate your call. And that's important. These calls going in, that lets them know that people are paying attention, and that's why they got to come up with these bogus explanations for why they want to dodge the bullet on this one. Focal Point, AFR Talk, back in 2.